Hi everybody, this is a video about using bioresonance therapy to assess for chronic infections. Before I jump into the meat of this video, if you don't mind taking a quick second just to like or subscribe or comment or share this video if you don't mind. Just helps to grow my channel, get my information out to more people. So if you find this useful, please consider doing those things so I can help other people by proxy as well. So thanks for taking a minute to do that. So somebody posted this question on one of my other videos asking if bioresonance testing could be used to assess for chronic infections or what I think about that. And it's a great question. There are different bioresonance devices out there. So bioresonance testing is, to my understanding, a method where essentially a person's hooked up to a machine, and that machine, then like via little electrodes, and then that machine essentially reads the frequencies or energetic output from the person's body, and then there is another part of the machine where something different substances can be put in there to kind of like start testing against the person's frequencies. So there could be like a spot for a little test vial that has like Lyme bacteria residue in it, or it might be a homeopathic remedy that has the essence of Lyme bacteria in there, or Bartonella or Mycoplasma or whatnot. And so then the idea with it, to my understanding, is that the machine's kind of reading the person's frequencies, then the clinician or technician or whatever is putting the microorganism or the frequency of the microorganism in the machine, and then the machine sees how does the presence of that microorganism affect the readout coming from the person, or maybe other devices would have the patient actually holding on to the test vial that has the Borrelia residue in it, or the homeopathic Bartonella or whatever it is, to see how that affects their output. And to my understanding, if the readouts of the patient look a lot worse when they're being exposed to that test vial or whatnot, then that would suggest that the patient has an issue with that substance in question. So they might do that with heavy metals and infectious microbes and mold toxins and this, that, and the other thing. And to my understanding, that's in essence how a bioresonance machine works. So can a device, or what are my thoughts about using that type of a device for assessing for infections? So as per usual, nothing I'm saying should be construed as medical advice, and this is for informational purposes only. And if you need medical advice, please talk to your healthcare provider to get that advice. So my opinion is that I don't really know enough to make a 100% definitive, have a 100% definitive opinion about the utility or accuracy of bioresonance testing. But what I can do is share kind of what I've sort of observed and what I think, at least from my experience so far. So I have some colleagues who swear by the usefulness and effectiveness of using bioresonance machines. I think they're really great clinicians. They get good results with their patients. I've heard good feedback from their patients. And so I think in the right hands, these types of tools can be useful. Now, does that mean that the tools are definitively diagnosing Lyme and Bartonella and this, that, and the other thing? I don't think we can make that extrapolation. But I know in the right hands, it seems to be a useful tool for some of my colleagues. So that's one observation that I've made. Another observation I've made is that I've looked into different bioresonance machines. Like, I'm a open-minded, curious guy. I like learning about different things. And at one point, I reached out to a few different companies that offer these types of devices, and I asked them just a really basic question, which is a question we should really ask of anyone who's offering any type of test, whether it's a lab test or a testing device or whatnot. And I just asked, what's the reproducibility like of your tests? So, you have a patient who's hooked up to the machine and they're tested on 10 different things, and it says 2 of them are problems and 8 of them aren't. If that testing is done a second subsequent time, how reliable or reproducible are the results? Because there are some devices out there that are kind of different from this. It's not like a manual, like let's test all these different things. It's more that they'll actually just automatically, because these are just computers inside of these testing devices, right? So they can program some of them where they'll just like automatically test a person on like against 1,000 different things. You get a whole readout of like, this is what you're toxic with and this, that, and the other thing. And so one of the advantages of that is it completely takes out the human factor, which is debatably a good or a bad thing. But in this case, at least if it's just totally an analysis from a machine, you can't really have any like operator influence kind of thing. You can't have like, oh, the operator, like the technician read the report wrong, or read the device wrong or something, or they were pushing too hard on this or that and maybe influencing things. And so so they have these like automated machines. And so I asked, like, well, what's the reproducibility like? And they said, they're not reproducible at all. They said, if we ran the same test, like back to back on someone, like we get totally different results. And they attribute that to something called the bystander effect, and started trying to explain that away with like some of the phenomena that are seen by quantum physicists when they're doing experiments and this and that. And that may all very well be true in the case, but again, like as a clinician, I'm thinking like, well, if we do this test, and I do it today, or I do it 5 minutes from now, or I do it 2 weeks from now, if there aren't any changes in variables between those tests, like they should all tell me basically the same thing. And so from what I was gleaning from those companies, what they told me, they said, no, it is absolutely not reproducible in that way. So that was one of the reasons that I decided not to pursue that type of testing in my own practice, because if it's not reproducible, then by golly, I couldn't wrap my head around how it might be, particularly reliable or useful for my patients. The final thing that I'll mention is that I have a number of patients who work with folks who use bioresonance testing or analogous types of testing, and sometimes they'll tell me that, oh yeah, I had this or that tested and I went on the treatment for this and I felt a lot better. It's like, wonderful. And then sometimes like, well, I tested for this, I went on the treatment for it, and it didn't really make me feel much better. And so I try to just have the type of brain that kind of compiles data relatively easily. And just with my overall observations over time, I found that it hasn't been, I have about an equal number of times where it's like, oh yeah, based on the treatment for testing through the bioresonance machine, like it helped, versus about an equal amount where it didn't really make much of a difference. And so that's just another bit of data that I have in my head. So it's not like, oh, every time somebody's working with someone who's using bioresonance to test, it's always a slam dunk, and it's certainly not always an epic fail. I'd say it's about a 50-50 in terms of the utility of it. And what I do have to wonder is, and I think about this myself too, like when I'm using, we'll say, more like traditional or stereotypical testing, whereas we're doing SIBO testing, or we're doing stool testing, or we're doing blood tests for Lyme and co-infections and this and that, and it comes, say the test comes back saying like, oh, you've got SIBO. Well, I put you on the diet, I put you on the right herbs and this and that, and you feel better. It's like, oh, I guess we successfully treated SIBO. Well, sure, I could retest and see if the SIBO is normalized, but some patients, when they're feeling better, they don't want to retest because it's kind of a pain in the neck to test, and it's costs a decent chunk of change. And so I think in those cases, I mean, I'm assuming that I was treating SIBO successfully there because they're feeling all better now, but it might be that SIBO was a red herring. Maybe I was actually treating yeast inadvertently, or a large intestine bacterial overgrowth, or a parasite, or something else totally different. So I think sometimes when somebody gets test results back from a bioresonance test and it says, oh, let's treat, you have yeast overgrowth, for example, and then I went on grapefruit seed extract and I felt so much better. It's like, yeah, maybe it's because it really picked up on yeast somehow. Or maybe it's that you had digestive issues. Statistically, that there's a pretty good chance there's a dysbiosis going on. Grapefruit seed extract is pretty darn good at killing a number of different types of microbes. So maybe it wasn't yeast at all; it was SIBO or something else. Or maybe it was just the dietary changes alone that made a difference, because there were actually just food sensitivities that were afoot. So I think that to have a really sort of honest, transparent discussion about this topic, the reality is that we don't have research studies indicating exactly how this type of therapy works. To my knowledge, at least, there might be studies out there. If there are, please comment and let me know where I can find them, because I'd be very curious to take a look. So I don't think we have hardcore objective data in terms of knowing exactly how these therapies work or exactly how reliable they are. But clinically, what I've just shared in the last, oh my goodness, almost 9 minutes. Sorry, folks, way too long of a video. If anybody's still listening at this point, kudos to you for having 8 minutes and 49 seconds of attention span. That's amazing in this day and age. These are my clinical observations. So thank you for the question. If anybody is still listening, and if you have any questions about this topic or anything else, just post in the comment section below. If you have had really great experiences or really negative experiences, or really any experiences at all with bioresonance therapy, or bioresonance treatment, rather testing, because there's bioresonance therapy as an actual therapeutic method as well, please feel free to post in the comment section below, as I'd like to hear your feedback, and let me know what your thoughts are about this. So thanks for your time, and I'll leave it there.